So, hello everybody, the viewers of PhysioTV, and from the team of PhysioTV, I extend a very warm welcome. This is Dr. Suloshri Mitra, Professor and HOD of Community Physiotherapy Department at Sancheti College of Physiotherapy. And we have a very special speaker for today who himself is a community physiotherapist. And something more special about him is he's our alumni. So Dr. Shubankar Mahapure has done his graduation from our own college, Sancheti Institute College of Physiotherapy, and he's also completed his master's in community physiotherapy. Dr. Shubankar Mahapure is head of exercise science department at Freedom from Diabetes Athletic Runner. He is a winner of state level research competition, which was Avishkar 2018. He has helped 20,000 plus people transform from diabetes to an athletic, which is great. And Dr. Shubankar is also president of the Paracletos organization. So Shubankar has also innovated a cost-effective isokinetic dynamometer, which is also sensory stimulator for peripheral diabetic neuropathy and graceful aging protocol. So I believe that the keenness or the passion to do something for people with diabetes was developed back in during the UG days. And today we are eager to hear you, Dr. Shubankar Mahapure, on role of physiotherapy in diabetes reversal and other metabolic disorders. And we'll be glad if you also share about the work you do with Freedom for Diabetes. And over to you, Dr. Shubankar.
Thank you so much, Dr. Sureshi ma'am, and I'm really glad to be here at this particular platform, presenting the role of physiotherapy in diabetes. So for the past 10 years, the organization called Freedom from Diabetes is working on diabetes reversal with the diet and exercise protocols. And I've been associated with this particular organization from past 3 years. And so we are a team of around 15 to 20 physiotherapists who are a part of exercise science department. And we have a very unique and very innovative protocol, which helps diabetic patients become free of their medicine, insulin, or both. So the biggest achievement for our organization is we have helped 14,000 people become free of either diabetes medication or insulin or both. So it's a pat on our back in a way. And in today's session, I'm going to highlight what is a role a physiotherapist can play. And this particular presentation can be helpful for all my dear viewers who are not physios to understand what is the root cause of diabetes and how can this unique protocol help you reverse it. Okay, so I have a very short presentation to show. So just sharing my screen. Okay. All right, so hearty welcome. And we are looking at role of physiotherapy in diabetes. Okay. So why does FFD? FFD is Freedom from Diabetes, the name of our organization. Why do we focus on health transformation? So you must be wondering, okay, what are we doing? So we are not just helping patients become diabetes free or diabetes medication free, but we are also helping them transform their lives. We are also helping them not just exercise on daily basis, but also we are trying to help them to become an athletic person. So I'll be sharing a lot of stories, and at the end of this presentation, I'll be sharing a certain tips also. So I'll be sharing 10 major tips, okay, which are diet and exercise related, which can help you if you're a diabetic or your family members who are diabetics to which you can implement and see quick results. Okay, so I begin my presentation. First, let me tell you what and why do we focus on health transformation. Okay, so as we all know, reversal can reverse. Okay, so we talk about diabetes reversal, and in In the recent era, we see diabetes reversal is a game which is kind of played of a lot of players by a lot of players. We see a lot of our competitors who have come into picture who kind of claim that they can reverse diabetes, but we are not just looking at a reversal itself. Okay, all the patients who come to us do reverse diabetes, do reverse their health condition, but we are looking far and beyond. Okay, so we see reversal, which can re-reverse, which means the sugar levels can reduce, the fat reduction can happen, BP medication can reduce, cholesterol reduction, insulin or medicine reduction. So this is all a part of reversal. But the advanced stage of reversal is freedom. So we are looking at freedom when insulin, diabetes, and other medications stop. That is when we say, okay, freedom has happened. Okay, all this can re-reverse. Okay, a person who has lost certain kgs can again gain. Somebody has stopped medication, may restart half a tablet or so, depending on whatever condition. But we are looking at transformation, as I said. So we know that the solid, liquid, and gaseous form can always re-reverse, right? But what we are actually looking at is transformation. So when we say transformation, we are looking at muscle gain, looking at exercise capacity improving 10x, okay, feeling fitter by more than 10 to 20 years, okay, looking younger, becoming a role model. Okay, so we have a lot of role models. If you can see on our background, we have all the heroes and role models who have transformed their lives, and there's a banner that we have put in our clinic. All right, so yeah, so this is a very important test, glucose tolerance test. So glucose tolerance test is having 15 teaspoons of sugar, and after having 15 teaspoons of sugar, your sugar level is still normal. Okay, so a lot of our patients, thousands of our patients have cleared glucose tolerance test. And to felicitate them, we do invite them at the Mukta Utsav program, okay, which we have once a year. And we have this grand event wherein, all of them are felicitated. Then becoming wiser, diet-wise, fitness-wise, psychologically wiser, medically wiser, okay, wherein we make and educate people on diet, exercise, mental health, and the psychological health, and the medicine part as well. And of course, the intention is to make them independent. Okay, so that's that. So from caterpillar, they become a butterfly. Okay. All right. So here is the story, a very, very shining example of health transformation. So he's our participant, and we say Anand 2.0. Okay. So Anand 2.0 is a transform person. So Anand Maheshwari from Noida, UP. He's a general manager at French MNC. He has passed the GTT. Okay, he's passed the GTT in 2021 recently. In 2022 also. So thrice he has cleared the GTT. His reversal journey, if you see, HbA1c is 5.7 without medicines, and he's free of diabetes medicines since July 2020. Cleared GTT thrice, that's his transformation journey. Does 21K marathons, 50 kilometers cycling, okay, and all of this he has started doing after joining us. Okay, he does 108 Surya Namaskaras regularly, and he's totally wise on all 4 protocols: the diet, exercise, psychological health, and the medical health. Okay. So in today's session, we are going to see 4 things. First, we'll look at what are the 7 root causes of diabetes, obesity, and related disorders. So I'm sure that all the physiotherapists will be aware of what is the root cause, and you can guide your patients accordingly. 4 phases of reversal: freedom and transformation. Okay, so these are the 3 terms. Reversal is your health status reversing to a certain extent with respect to numbers. Freedom is you become free, meaning your medicines have reduced, that is reversal. Okay, your HbA1c has reduced. HbA1c is a 3-monthly test, average glucose, which measures your average glucose for the past 3 months. Okay, and so if the HbA1c is reducing, the sugar levels are reducing, then reversal is happening. But if at all you're becoming medicine free, okay, then freedom is happening. And if you're becoming something like this, then there is complete transformation which is happening. Okay, so that is reversal, freedom, and transformation to us. 4 protocols, including physiotherapy to reverse diabetes and related disorders, what I'm going to highlight you on. And of course, while going away, we'll know what are the 10 plus tips for diet, exercise, and what are the action items. Okay, you can immediately implement and see immediate results. Okay. All right. So before we move further, let us look at reversal and transformation, which begins with a root cause. Okay, that is rise in insulin resistance. So we actually look at and work upon the root cause, which is insulin resistance. Okay. Now there are multiple tests to see what is the sensitivity, what is the insulin sensitivity, and we have all the numbers. Okay. And it's the best idea to not have any subjective feedback, but to have numbers which are very, 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 very powerful. Okay. So insulin resistance can be caused by 4 diet related causes. Okay. 2 exercise related causes and 1 stress related cause. All right. So what are the 4 diet related causes? What are the 2 exercise related causes? And what is that 1 stress related causes? What we're going to look into deeper sense in this particular exercise, in this particular session. Sorry. Okay. So these are the 7 reasons. Okay. So right from the cellular part, we are going to explain you. So first one is the insulin-like growth factor, which is a diet-related cause. So one example is a lot of patients who have diabetes have milk and milk products. Okay, so milk and milk product will actually give a rise in insulin-like growth factors in your body. Okay, so yeah, so here if you see what are the what are the quick things is replace regular milk with coconut, almond, or any plant-based milk. Okay, so there's a quick action item that you can take to replace the milk that you actually have now. Okay, or have herbal tea, green tea, white tea, black tea, or infusions. So this is one way of looking at it, and this is another way of looking at it of how you can have milk. Okay, so green tea, herbal tea, white tea, black tea will give you benefits, but again, replacing regular milk with coconut, almond, or any plant-based milk will give you even additional benefits. Okay, so we recommend that diabetics should replace the regular milk, okay, with coconut, almond, or plant-based milk. So that's that. So habitual tea and coffee drinkers, do not stop it. All right. Then second diet-related cause for insulin resistance is acid and inflammation. Yeah. So acid and inflammation in the body. Third thing is the excess fat. Okay. So excess fat in the body will definitely cause more insulin resistance. So when you say excess fat, one of the most interesting and complex, there's a very, very interesting and very, very complex study. Whenever we say excess fat, we just sometimes feel that it's just the subcutaneous fat that we see. But if you see in Indian specifically, you will see all those who are diabetics, some of them will be thin as well. Not everyone will be obese. Most of them will have obesity and will be overweight. But for a few who are lean, and low BMI category, will have more fat on the tummy region, but their legs and hands will be still leaner. Okay, so these are 2 books which you can refer, and these are 2 stalwarts whom we follow, and they are the pioneers, okay, of reversal and diabetes remission. Number 1, Dr. Neil Bernard. Okay, the Neil Bernard, he has this particular book which you can refer to. Okay, so he has this program for reversing diabetes book. And Dr. Roy Taylor, who has this book called Life Without Diabetes. Okay, so we got a chance to meet Dr. Roy Taylor last month. He had come for a conference in India. We got to meet him at JW Marriott, and it was very, very nice, to be honest. Okay, very humble person, very gentle and very, very knowledgeable. So yeah, so Dr. Neil Bernard said that the excess fat is inside the muscle, whereas Dr. Roy Taylor says that the fat is inside the livers and the pancreas. So liver and pancreas fat is what Dr. Roy Taylor suggests is what the reason for insulin resistance. Okay, so here if you can see liver and pancreas fat before and after. Okay, so this is a baseline. Okay, this is the liver fat, if you can see, 30.4%. Post weight loss, 1.3%. In pancreas fat also, if you can see, 8.9%, and pancreas fat has reduced to 7.5% after considerable weight loss. Okay, so this is all about the excess fat. So acid and inflammation in the body. Then third one was excess fat. Fourth one is lack of micronutrients. So in our diet, we include a lot of things which does not provide us micronutrients. Okay, so insulin resistance is one of the so lack of micronutrients is one of the major cause for insulin resistance. Okay, now let's move to what are the exercise related causes, and this is what I think most of the physiotherapists would have a role to play here. So exercise related insulin resistance, fifth cause is stagnated lymph or stuck up blood, to make it very simple and layman language. So stagnated lymph and blood. And sixth cause is reduced muscle strength. So these are the two important things when we talk about exercise related insulin resistance. So stagnated lymph and suck up blood and reduced muscle strength. Now it is important to understand, apart from these two causes, physical inactivity is very, very common. Physical inactivity in, especially in our country, we see a lot of patients, thousands of patients coming to us every month. When we ask them what exercises you are doing, okay, they just have two things to say. We do yoga and we do walking. Okay, it's unfortunate that whenever people think of diabetes and exercise, they think of yoga and walking as the only option, because most of the endocrinologists, most of the physicians who are the first point of contact to all the patients recommend walking as an exercise. Okay, but to bust the myth, which is walking helpful for reversing diabetes, I would say walking is just a part of life. Walking is just a mode of transport. It cannot be considered as exercise unless you do it anti-gravity and unless you have variations in walking. So I have a video on walking, walk at home, and Leslie Sanson, also has a very good YouTube channel called Walk at Home. So those walking variations are very helpful rather than just level ground walking without variation in speed, intensity, and frequency. All right. So that's all about walking. So physiotherapists should take this thing up, and it's a good scope for all of the physios to get into the public, get into this particular stream wherein you can make good awareness across the nation, across the world, wherein you can tell all the diabetics that walking is not the only exercise, but there are other exercises which are more helpful for reversing and improving and managing your diabetes. Okay, and extensive research can be done. So those who are interested in research can help us, can collaborate with us. We have huge database. Okay, there are close to 1,000 patients joining us every month to attend our program and who enroll into our program. Okay, so we have extensive database. So you feel free to collaborate with us if you want to do more research on what is the effect of exercise that we recommend versus just walking. Okay, and of course, a lot more research is to be done. And I am foreseeing that, metabolic physiotherapy, wherein we deal with only metabolic disorders, becoming a reality soon. Okay. Yeah. And the last one is a stress-related insulin resistance. So, of course, the stress hormones play a very, very vital role in building up insulin resistance. So we have a lot of patients coming to us, say, sir, I exercise very frequently, eat my diet very frequent, a very healthy diet, but there's just stress, So typically, all the patients are joining us. They are left by their children who go abroad. There's a lot of depression, anxiety. So we do take a mental health questionnaire before they join us, and you will be surprised to know that more than 40% of the patients who join us do have some amount of anxiety, some amount of depression, some amount of some of the other psychological issues. So that is one thing that we can look at as physiotherapists as well. Psychology, psychiatry, diet, nutrition is a part of our syllabus as well in UG and in PG in even more depth. So of course, this can be taken into consideration when you see a patient with diabetes. Okay, moving further quickly, how to reduce excess insulin resistance. It's very simple, what to do and how long to do. So first thing that you need to do is make body alkaline. So help your patients, and if it is for your own self, then make sure that 3 months you make your body alkaline and improve the micronutrition. Okay, then eliminate the excess fat which is there. So 3 to 6 months with step number 1. You definitely eliminate the excess fat. So 3 to 6 months, this process will go. Again, 3 months with step number 1, you will do, circulation and activation of muscles. Okay, then build muscles the next 6 months. Okay, find your unique ways to manage your stress. So that will again happen over a period of 6 months. That's after step 3. So building muscles and finding unique ways to manage stress will come under step 3. But the first most important, things to do is to alkaline your body, have good micronutrition, eliminate excess fat, okay, and circulate blood first. Okay, I know too much of information. So before we proceed further, let's take a deep breath in. Smile on your face, wherever you are, and release. Shh. Okay. And just sit back, relax, because now the thing that I'm going to share is even more interesting, because those are the key action items, that you are going to actually follow, recommend, or, follow and implement for your own lifestyle. Okay. So we move further and give yourself 1 year for health transformation. So 1 saal to banta hai in a lifetime to actually transform yourself. Okay. Let me introduce you to a person who is on a quest of understanding and transforming human beings. Dr. Pramod Tripathi, founder and CEO of Freedom from Diabetes. So he has done his MBBS, and for all Sanchetians, he's a batchmate to Dr. Atul Patil. So he's he's completed his MBBS from BJ Medical College, Pune, MBA from SIBM Pune, Symbiosis, Advanced Diploma in Yoga and Ayurveda, TMB Pune, Professional Diploma in Diabetes Management from Nanavati Hospital, Mumbai, Yoga Instructor for Diabetes Movement via DM, S. Vyasa, Bangalore. And of course, he has done a lot more integrated courses like Art of Living, Advanced NLP, Practitioner, Brahma Vidya, Certified NLP Practitioner again, Dream Therapy, Reiki, Pranic Healing, Soul, Mind, Body Medicine, and Vipassana. Okay. So everything is, so all in one is what we can say. A very unique person, our mentor, and a big influencer. All right. So let me take you to the 4 protocols quickly of how do you actually get into the holistic transformation program. What are the phases? So first phase, we focus on establishing a strong foundation. Okay. Remodeling body and mind completely is phase 2. Okay. And this entirety is stage 1. Okay. So in stage 1, we have phase 1 and phase 2. Achieving basic health goals like, getting your BMI in place, HbA1c in place, and other parameters. Okay. We move further to stage 2, wherein we focus on achieving the advanced health goals, such as fitness, medical, etc. In this, in phase 3, we typically focus on creating a transformational story. And phase 4, we help patients gain complete health mastery. Okay. So you can see a person getting out of the cage. Okay. So here we, ask them to make the transformational story and master and become a master of their health. Try to make them independent as well. That has been our motive. Okay. So 4 protocols, as I've been mentioning again and again, which is diet, exercise, inner transformation, okay, and medical. So diet again has to be scientific and natural diet, which is proven to work, okay, because there are so many diet protocols, keto hai, Mediterranean hai, Dikshit diet, and a lot many, Biswaroop diet, and a lot of variations which are coming up. But make sure that before you choose to follow any particular diet, make sure that it is scientific, natural, and it's proven to work. Okay, it has helped our 14,000 patients become free. The diet that we recommend. Okay, so choice is yours, what to recommend and what to follow. Okay, exercise that is progressively adapted for you. So here the physios will play a very critical role. And for your information, 9 out of 10 patients who come to us with diabetes do have frozen shoulder. Okay, so we have built a very nice protocol for frozen shoulder patients. Okay, and it does help our patients to, improve faster with the exercises that we recommend for frozen shoulder. Okay, so frozen shoulder is one. Peripheral diabetic neuropathy is second, which is commonly seen in diabetics. So these are the 2 major conditions. Carpal tunnel syndrome, again, very rarely, but we do see if there is any kidney malfunction. So frozen shoulder and peripheral diabetic neuropathy and other musculoskeletal disorders, if there are any, is what a physiotherapist can effectively handle. Okay. So if at all you see any frozen shoulder case, you can first ask if he's or she is a diabetic, and you can definitely share the tips that I'm sharing with you now, and that will definitely help you. And if at all you are interested in research, you can get in touch, or you can individually try to do research deeper into the field of diabetes and medical. So I'm not going to details of much of the diet. I'm just taking you through the slides. Phase 1, we focus on alkalizing diet, cleansing diet, 3-to-1 foundation diet, 3 months, as I told you. Weight loss or muscle building diet. Phase 3 is muscle building diet again, and maintenance diet in phase 4. In exercises, this is most important for you. So phase 1.1, we see ACEs and AGES, activation and circulation exercises, and anti-gravity exercise. So anti-gravity exercise, extensive research has happened. Okay, we have published multiple papers, okay, which show the effect of anti-gravity exercise on sugar levels. Yoga and strengthening, and 3-to-1 foundation in the phase 1. Phase 2, we have customized exercise plan. Okay, in phase 2, we make sure that people focus on their tummy, reduce their waist size, and we have named one of the protocols as patlikamar.com. So a lot of our patients do follow this and make their kamar patli. So yeah, leaner waist. Then phase 3, we ask them to help we help them to grow in athletic identity. Okay, and phase 4 is a fitness goal based protocol, in which we make them do or we encourage and motivate and inspire them to run a marathon, do 100 kilometers cycling, and swimming, go to gym, and do 108 Surya Namaskaras as a part of yoga, try difficult asanas. So all of that is what we actually help them do in the phase 4. Okay, so here are some 10 diet and exercise related tips for immediate results, and I start the first one, which is stopping the milk and milk products. Okay, so for 2 to 3 months, stopping of milk and milk products will give you good results with if you are on a diabetic side. If your HbA1c is more than 6, Okay. Start the stunning nutrient dense green smoothie. So this you can do for at say 6 to 7 a.m. So green smoothie preparation. So you can just type out on Google or YouTube, just say green smoothie by Freedom from Diabetes, and you will get the recipe of it. 3, 4, 5, do the world's best warm up. So I have a video shot. I've shot a video on world's best warm up. So just Google world's best warm up. Thousands of people have watched that and following are benefited. So it's a mixture of all the recent techniques, okay, taken from Japanese techniques, massage techniques, and a lot of other therapeutic techniques, which help in relaxation of muscles, activation of muscles, and improve the blood supply. Okay. So world's best warm-up. Super brain yoga is against squatting, but in a little more scientific way. Chair Surya Namaskaras from 7 to 8 a.m. Then structure your breakfast. Okay, that's the sixth advice. 25% sprouts, 25% salad, 50% of cooked dal-based items. Okay, this you can do it at 8 to 9 a.m. So these are the takeaways, okay, of this session. So if at all you find, if a physio is watching this, you can recommend this to any diabetic patient that is coming to you, and you can keep a track of all their sugar levels, so they can build a log of it and you can see good results happening if they are following this. Okay, structure your lunch and dinner. 25% each salad, 25% each. So in which you have salad, cooked vegetables, dal and grain. Okay, so that's about lunch and dinner. Have soaked nuts, which is 8 to 10 nuts, and 3 to 4 teaspoons of seeds. Okay, this you can have at 5 p.m. 9 and 10, these are very, very important exercises. Staircase climbing and nitric oxide dump as anti-gravity exercises. So 1 hour 45 minutes later from the start of the meal, meaning if you have your lunch at 1 o'clock, then 1 o'clock if you start your lunch, okay, the first muscle, then 2:45 you can start these exercises, and 3 o'clock you can take the sugar readings and you will see 30 to 40 point drop. Okay, you will see 30 to 40 point drop in your sugar level, okay, or in the sugar level of the patient. Okay, so that can be tracked and see the benefits. So definitely a physiotherapist will having knowledge of medicine, diet, exercise, and bit of psychology can definitely help this particular community, the diabetes community. Okay, so 1 hour 45 minutes later, after dinner at least you can start, if possible after breakfast and lunch too, for 5 to 10 minutes, not much. So how much steps to climb? 100 to 150, can progress up to 100, 150. Nitric oxide dump is again an exercise. So you can take a screenshot of this particular slide and share and implement. Okay, the nitric oxide dump is again a very, very effective exercise. Okay, introduced by Mark Bush, and it's really very, very helpful in reducing the sugar levels. Also, it has shown good effect on hypertensive patients as well. Okay, so that's that. So what has made such amazing changes happen is the program that we have innovated. It's a holistic transformation program. It was earlier called the intensive reversal program, and the secrets of FFD program is an approach that creates step-by-step shift in human behavior in the individual and family. Okay, so again, we have a lot of personalized guidance and group therapy, a lot of it. Yeah, and this program typically have benefited people in lifelong change in understanding and in their daily habits, transformational shift in positivity and identity. Okay, tension-free seamless reversal. Okay, benefits beyond diabetes such as weight loss of average 7 to 12 kg, improving in strength, stamina and flexibility, or strength, cardio, pulmonary endurance and flexibility, reduction and freedom from other medicines. So we have seen good numbers in BP, cholesterol, thyroid as well. Okay. Yeah, so that's what we are doing. Our reach is all across India. So I just traveled to Odisha and we have a lot of patients there as well. So you go to any city in India, we have FFD reach there, and across the globe as well, in all parts of the country. Change is hard at first, messy in the middle and gorgeous at the end, says Robin Sharma. So this is what we do. Why are we doing this is to help patients regain health and enjoy freedom. Okay, and this is what everybody wants. It's very, very painful. Okay, I'm telling you this because I've seen patients offline injecting insulin, okay, and taking a lot of medications. So definitely, there is financial burden. And if at all there is someone who's coming from, lower socioeconomic status, it's very difficult to afford diabetes. वो कहते हैं ना गरीबों को diabetes नहीं होता है. That's a fact because they are naturally active, physically active. So we are helping people to regain their health, become a master of their own health and enjoy freedom. Okay, for whoever experiences freedom. How are we doing this? Correct education, and which you all also can do. Okay, comprehensive support and constant inspiration is what we require. What are we doing? The most effective holistic transformation program with a proven phase-wise design adapted to individual needs with energy-filled, high-touch and super easy high-tech. Okay, so we are focusing on high-touch and high-tech both. So human touch is very, very important. How much ever the technology improves, the human touch is required in the field of healthcare. Okay, so as a physiotherapist, be supercharged. Okay, if you see any diabetic person, any diabetic patient coming to your clinic, you know what to do. Okay, so thank you so much one more time, even as we close. Thank you so much for joining, and over to you, Suresh.
Yes. So, Dr. Shubankar, knowing you as a teacher also, it gives me immense pleasure today that you are speaking about such an important issue, which is so important, especially in our country, as you ended with your quote on Garib and Amir, everybody. So what I want to know specifically after knowing that you all are doing such an extensive work on for freedom from diabetes, that what do you think now in our country, as per our culture or as per our factors, socioeconomic or many other factors, cultural factors, what are the main barriers of which you all come across when you interact with these patients on daily basis? And these key factors, if we can, one, of course, you have shared it in your presentation, but something which you want to again hammer so that, our audience knows, not just the physios, the medicos, also the non-medicos, everybody is aware of it, and we take care of these key points on daily basis.
Oh, yes. So the first barrier, ma'am, what I feel is there is no ecosystem around a person. Okay. So if there is any particular metabolic disorder, say diabetes or hypertension, usually patients from any category or any background they're coming from, they do see a physician, they do see the general physician or an endocrinologist or any specialist. But then the comprehensive support which is required from diet, exercise, and from psychological perspective is lagging. So that is what is needed. So for all the physiotherapists, the major concern or major barrier is the collaboration. So that's a major concern. So we have seen a lot of individual practitioners, like a lot of lifestyle clinics which are opening up. But if at all there is collaboration of all the experts together and cater service to our nation and across, that will help our society to overcome this particular disease or disorder.
Rupja. Yes, I think this is something which we all should note very importantly, that collaboration is the need of the hour, whether it is working for the patients or doing any clinical research. Collaboration is something we all should look forward to, and I totally agree with that. So with this, I think I would again like to thank you for such a wonderful and insightful talk, especially something which is something you are actually doing. And from Sancheti College of Physiotherapy, we all are very proud of you, and we are glad that you are doing so much for the health promotion of the citizens of this country. And we hope that we also are able to collaborate with for something greater, to bring about more awareness and bring about change in the daily routine and lifestyle of our own countrymen. So thank you so much, Shubankar, and thank you from PhysioTV team. And hope we all we get to know more about your work in health promotion for different population. Thank you so much.
Thank you so much, ma'am. Thank you.